Welcome to another episode of HealthTech with Purpose podcast. Our today's guest is Ari Tulla of Elo Health. Ari is the CEO and co-founder of Elo Health, which is on a mission to personalize nutrition using the power of AI. With a long history working in the field, Ari will brings a wealth of experience and a strong vision for how technology can empower individuals to live healthier lives. We'll be diving deep into Ari's background, the exciting work happening at Elo Health, and the future of AI driven personalized nutrition. So, buckle up and get ready to learn from a leader whose purpose is to transform healthcare with technology. Hello, everyone. Welcome to another episode of Health Tech with Purpose podcast. And today's guest is Ari Tulla, who is building a platform that allows blood and digital biomarkers and using cutting edge AI and expert guidance to deliver smart nutrition products calibrated for your unique needs. Welcome, CEO and co-founder of Elo Health, Ari Tulla. Hi, Ari, how are you?
Hey, thank you. Great to be here.
Okay, great. Really looking forward to this episode recording because something that you're doing is very unique and very fundamental, I must say, to everyday's habit. So, rather than solving those big things, I would say in healthcare, you are solving that foundational need of everyday usage. So I would really like to know more about what you guys are doing and overall your story. Let's start from there, Ari. Your background and what got you till here.
Yeah, certainly. I'm from Finland, originally a small country in Northern Europe, and been the last about 16 years here in the Bay Area, building companies. And I was a athlete and a geek when I was a kid, and got into computers very early in the 80s, and then got to become a video game aficionado in 90s, and played, I don't know, hundreds of hours a week or a month, and probably spent my 25,000 hours of video game playing time. Became a semi-professional video game player, one of the first people in Europe making
Uh,
money on by playing video games.
wow,
And that later led me to
child's dream.
yeah, that later led me into a startup in 99. I was working, with my roommates to build websites for big corporations, the Web 1.0, the first websites people ever had. And that company, it grew to almost 200 people in Finland and Sweden and Norway. That was a cool experience to kind of see, that young kids can build something. And then later I worked quite a while at Nokia. Every
Okay.
Finn has to be at Nokia. That was the Nokia's heyday, and I joined Nokia a long time ago, and that was the team that built the first smartphone, the N95. And it was super interesting to be part of something that completely changed the world. And with Nokia, I came to San Francisco to build a new kind of unit here for Nokia in video gaming. So I was back in the games at Nokia, and worked many years on building the first smartphone, the games on the mobile phones. And then around 2010, bless it, we had health issues in our family before already, but it was really difficult for us to get pregnant, and my wife had a thyroid issue tumor 2000, and that led us into these hormonal imbalances, autoimmune issues, and difficulty of getting pregnant. So we used a lot of different, Western, Eastern medicine to try to solve that. And in the end, we found that food was medicine for us, and food
Mm,
helped my wife to heal her body. And
okay.
we finally got pregnant with IVF, and then we were very unlucky that in the end, we lost our first son. And that was the time when I decided that, I'm going to spend my next 30 years in healthcare. So I came from like, gaming, mobile devices, web apps world, and started to build a company called Better Doctor. And that was a doctor finding service. And
Okay.
we later, it became pretty big. We have 20 million people using the service. We sold it to private equity. Then I was running a company called Quest Analytics. It was a pretty big company in the space of helping people to build doctor networks. And today, it's interesting that Better Doctor is part of that company, and
Mm,
every person more or less in the US who look for doctors, they use our data as a backbone. So it started from our problem that we couldn't find the right doctor in the US. And today, that problem is helping 200 million people a year. So it feels pretty good that, you have done this one thing that
Wow.
has a big impact in this
Mhm.
this ecosystem of healthcare. And nobody knows the name anymore. We are behind the scenes backbone for the data, but we are still there, and it makes me feel good. And the last 3 years, I've been building a new company called Elo Health, ELO, and the focus is to try to make food into medicine. And like you said already, trying to use the biometric data from our bodies, trying to use blood biomarkers, digital biomarkers, health assessment, and then turn that with AI into the right nutrition plan that can keep us healthy, or even maybe reverse illness we already have, like type 2 diabetes or heart disease. And it's been a really fun journey because we spent a lot of time in my family. We spent decade of trying to find a solution to my wife, and food became medicine to us. And now we have two wonderful kids today. So
Mm.
it paid off in the end. So every time I look at my kids, I remember that food can be medicine, is medicine, and but it's a very complicated topic, and
Yeah.
it's there's no simple answer like how to do it because we all like our highly processed food that is poison, but it's very tasty. So
Right.
that's the problem today we have. And I think we all know as people what we should do right, but
Mm.
we just don't do it because it's so difficult to change behavior. And
Mhm.
but yeah, we can go deeper into the problems in a later point. But that's kind of roughly my story. And I mean, I'm so thankful for the life that has given me ability to kind of work in multiple different fields because you get such a wide array of experience when you work in like devices and apps and websites and healthcare and all this stuff. And it's been really fun.
Right, right. Very interesting background you have, Ari. Like like you said, like gaming, Nokia to health, and solving your own problem, and then building a company out of it, and then scaling it to the level that you have done in the past, and now with Elo Health as well. So, very, very interesting. So tell us more, let's go deeper a bit into Elo Health and, like what kind of work you guys are doing because, again, like you said, it's a very wide space. And I think, especially coming from India, I can very well relate to that whole vision that food is, kind of the medicine for your stomach. And most of the sickness basically start from the stomach, basically. So that's the whole thesis behind Ayurveda as well, that incepted in India. So tell us more like how Elo Health is, using the old age knowledge and the new age technology together and building the solution.
Yeah, so the when you build a company, every time you need to build a box, you need to pick a box that you play with or you play in. And this is like you said, it's really vast. I mean, this is like everybody will eat, multiple times a day. Food is the biggest industry in the world. We talk about, $10 trillion of money. It involves, climate change and cultivation of crops and everything. It's very big. And now, we have fought wars about food, probably since the man was walking or woman were walking. I mean, we talk about like 100,000 years of wars because of food. So it's maybe the biggest single
Right.
issue we have. And also not only that, but, food is culture. Are we
Mm.
here to eat? Or are we eating to be here? I mean, people debate about that every day. So for us, it started in a way that, okay, how do we make a mark? And it's very crowded. There are many companies who do, different type of
Right.
nutrition products. So
Yeah.
we decided to build this box first in a way that what can we measure?
Mm-hmm.
What can we deliver to people that can
Mm-hmm.
have an impact and then measure again? And then build around that a coaching layer where we can coach people to the right things. That was the
Mm-hmm.
beginning. So first thing we did was we found a lab and we started to work with the lab and built an at-home testing kit that we can now test different biomarkers. We can do 75 different biomarkers today with our partners. Not, of course, at once because it's home testing, so we can do around 12 to 15 any given test. And today we mainly do people a pretty holistic test where we look at your cholesterol, think about lipid panel, triglycerides, ADL, LDL, and so forth. We also look at your A1C inflammation, the marker for diabetes. We look at
Mm-hmm.
inflammation, homocysteine. Then we look at vitamin D, vitamin B, iron, and others. So pretty
Mm-hmm.
good panel that will give you indication what's wrong. And of course, then we also, get people to fill in a pretty detailed health questionnaire. So we understand your diet pattern, your exercise, sleep, stress, all these things. And then if you want, you can also connect all your wearable devices. Like, I have an Apple Watch, I have a Whoop, I have an Oura Ring, I have a glucose monitor. So you can connect your data that you already are collecting into Elo by using Apple Health. And Apple Health is this unbelievably powerful platform that can connect health data into different services in a secure way. If you want to stop that connection, you can stop it whenever you want. So
Mm-hmm.
it's really safe way to do it. So that's what we built. And then we built this model, an algorithm first. This was like a few years ago. So we built an algorithm by looking at all the different human trial data and science about nutrition. Like if you, let's say, have high LDL, what can you do in nutrition perspective to lower it or manage it? Okay, if you have, high or low vitamin D, it's pretty evident. You can get sunlight, or you can eat vitamin D heavy food, or you can supplement vitamin D. That's pretty easy to understand. But then about A1C, what do you do to manage diabetes? A lot more complicated. You have to kind of change diet, you have to change different things. So we started to do that, and we collected all the 6,000 studies ever done in the world, and we tagged them, uh, built them into the algorithm and into the AI. So we trained the model with that data. And it's a lot of work because we had multiple people working
Right.
for that now 3 years to do it. And now it's done. And now we are, of course, new studies come in, we add them every quarter into the model. So what we
Mm-hmm.
then do, we take who you are, we take your age, gender, eating behavior, stress, weight, height, all these details, and your blood biomarkers, and we then map them with the system into the research. And then the research will tell us what is the optimal focus for you, what we should give for you based on who you are and what the data tells. And then we
Mm-hmm.
went on to find partners. So we have partners now to build powders, so we can do like protein powder type of products customized to you. Every product is handmade for you. We can do pill packs, pill supplements, every pack made for you. And then we latest product we have is gummy vitamins that we 3D print just for you. And
Mm-hmm.
the 3D print gummy vitamins, for example, we have 389 million combinations today in the beginning. So it's pretty unique that we're probably going to sell to 100,000 people. We have never sold the same twice. It's pretty unique. So
Mm-hmm.
that's what we built. And now this whole thing has been around and running with thousands of people for the last year and a half, 2 years. And now we have accumulated data, and we now know that
Right.
people who come in, 90% of them have something, the assessment level. They have something on yellow or red, like you sleep too
Mm-hmm.
little, or you have low vitamin D, or you have, you're overweight. And then when they are with the program for 6 months, many of those issues are fixed. I mean, you can't fix, being overweight by eating supplements, no way. But we also had a coaching layer. We had human coaches, dietitians who work with every person, and they guided people to change behavior and patterns and so forth. So that's something that we now have, and we call it Elo Smart Nutrition Platform. And what are we doing this year now? We are starting to take this platform to our partners. Think about wellness or health companies and brands who already have millions of users. So we are going
Mm-hmm.
there and starting to empower them by bringing nutrition treatment into the mix. And that is what is starting to make food into medicine. And we are really in the forefront of this. We are some of the first people now doing this with doctors. And I'm really happy because yes, we want to go later into meal delivery and grocery delivery. That's important, but it's much more difficult to do because we all know food is very perishable. You can't
Mm-hmm.
send food around the US or in India. I mean, India has the most effective food delivery networks in the world. A lot of the workers are getting daily meals even from
Uh-huh.
home. It's unbelievable. I mean, I went to witness myself. And I mean, it's so cool. And we are not that good in the US yet, but it's getting
Right.
better. And now we have ability to deliver people's, home with different food and different groceries and stuff. But the price is still pretty high.
Mm-hmm. Right, right. No, definitely. The Indian story has to do with the economies of scale and cheap labor, of course, as well. That is available, that creates enough opportunity that makes it a win-win for all stakeholders, basically. So yeah, but that's great. That's great. So good to know, like where you are headed, Ali. So tell us more about some of the success stories, that Elo Health is able to achieve over these years. Would be very interested because it seems so inspiring. Yeah.
Yeah, so we, as I said, we focus on this idea of, assessing, planning, delivering, reassessing. So we get information, like I said, that, people have improved their blood biomarkers in a level that, their doctors are calling us and saying like, what the heck? And then the doctors are signing up themselves. I mean, that's the ultimate, compliment to me at least that, and, my doctor, my own doctor, for example, signed up.
Mhm.
And that's pretty cool because usually doctors don't really appreciate nutrition so much.
Right.
Um, but we made it scientific enough that even these people appreciate it. So one example that I could happily talk about is my own story.
Mhm.
We have few people that they are giving us permission to share their stories, but we are all HIPAA compliant. We are your data is your data. So I don't want to talk about anonymous people who whose
Right.
stories we haven't asked permission to. But my own story is, I think, very normal that we are seeing a lot. So I started with Elo, and I've been I mean, people call me a biohacker. I mean, I don't think it's true, but I mean, I've been doing this for a long time. I've been tracking my data.
Okay.
But my team took my DNA sequencing. They took my vitamin and mineral and blood biomarker results, and they realized that my vitamin D had been very low for a long time. It was flagged being low, but no doctor ever told me that I need to supplement vitamin D. And I'm from Finland, where you have barely any sunlight. Northern Finland, it's pretty dark. This time of year, there's no sun at all. And then I moved to
Right.
California, and still in California, my vitamin D was 15, the US measurement. Normal should be around 40 to 50. So I was far, far too low, dark red area. And they looked at my DNA and they realized, my team, that my DNA has two mutations that are making me a poor metabolizer of vitamin D. Of course, DNA gives a trait. It doesn't tell if you have it or not.
Right.
But based on the blood data, they knew that I have those both markers are active. And then they started to vitamin D supplement me. And it took a year to get me back on the normal level. Or I'd never probably been in a normal level. And
Uh-huh.
I had to take a like massive dose, like 4 or 5 times the normal dose of vitamin D for a long time to get there. And I actually started to feel different. This is happening, just before COVID. And I went to Finland and I hang out with my extended family and we tested, all of them, sequenced them all. And they all had the same mutation. And then
Mhm.
we mega-dosed them with vitamin D before COVID, and nobody died of COVID in my family. So I was pretty happy about that. And we have some pretty old family members. So that's a one example. And another one I have personally is that, I also have a mutation in my iron metabolism. So I deposit iron. So if I take iron supplements and that are heavy, I might deposit iron to a level that I might actually die of iron poisoning. So that was good to know also that, came in this. But overall, like I never took supplements before in my life. And I've been an athlete all my youth and still. And I realized that, there is a place for supplementing because the diet we are having today is just very poor on basic nutrients. And
Right.
every
That's
year we are eating
the whole
food
point.
that is less and less, we do add supplements or minerals, vitamins in some foods like we do like milk and whatever. But still, most people have basic vitamins and minerals and biomarkers on red and they don't know about it. And those are easy to fix. So there is a place for this. But I always say everybody, supplements are supplementing. It's supplement. It's not same as food. You can't
Right.
become healthy by eating a pill a
All
day.
supplement for a reason.
100%. Yeah. So you have to focus on the diet and that's area we talk to a lot about our customers and our members about like how to eat right.
Mhm. So currently the solution Elo Health is a B2C, or the primary channel is through partnerships, a B2B2C kind of model. How are
We are
you?
we are B, we are almost 100% B2C today, we are just going live with the first B2B partners in the coming months, and two big ones are coming live in this quarter. So we are getting there now. But I mean, I always knew when we built the company that D2C is a great way to start, great way to learn about customers, what they need, build a really good product. And I mean, just like to give an example, it is pretty cool when you.
This episode of Health Tech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health where accessible, equitable, and patient care prevail.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to Health Tech with Purpose. Make sure to subscribe us on Spotify, Apple, YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
When you can have now a product like this. This is the 3D printed gummy vitamins. So this gummy vitamin has the same supplements I have in my Elo pack, where you have 6 supplements here. So I mean, how cool is it that you can have much more convenient method of delivering it that is beautiful, tasty, and equally effective. We did the testing in a 50 people pill group, 50 people gummy group, for example, vitamin D, and we realized that the outcomes are the same. Only difference being that almost everybody preferred the gummy because people like to have treats.
Of course.
So I think going to B2B2C happened also at my last company, Better Doctor, where we were D2C first, and then we became B2B2B or B2E company in the end. But I mean, it's a good way to start to learn. And I think, in the coming years, majority of our revenues and numbers are coming from the partnerships.
Right, right. Yeah, I believe that B2B can definitely give that scale that is required. And on the gummy thing, since I have kids, I think you will make parenting difficult because there's no difference between trick or treat. So yeah,
100%.
but that's so cool. That's so cool. So, Ari, like, tell us more about since you have been kind of so deep into this subject about the old age and the life expectancy and like how someone with better habits can over a period of time make themselves better and like free from any kind of illness. So tell us more about your learnings from say preventive care and the proactive health practices, for example. That would be very interesting, even if someone is a customer or not, but it's always interesting to hear and that.
Yeah, so I think the interesting thing is that I'm coming from Europe, of course, to the US, and being battling with health issues in Europe already is very different. Like you get the doctor who's given to you. In the US, I had a kind of like executive health plan from Nokia. I can go to any doctor I ever want. We have a million options. So
Yeah.
how do you know who do you go? That was a very different market that you face. In the US today, we spend about $4.5 trillion this year in healthcare. $4,500 billion. By the way, that's almost 45% of the global spend in healthcare. Almost 40%. How many people we have in the US? We have 4% of the global population. Think about it. We 10x over index on the spending. Yes, I mean, we do spend a lot of other stuff, but nothing like that in any other market. And then I always talk to people like, how do you measure healthcare system of a nation? How do you measure it? I mean, it's tough. And I think the only way to measure it is to look at life expectancy on one axle, and the other axle you measure cost.
Right.
US is such an outlier. It's so funny when I do the presentations. Like, here's the normal graph. You have to zoom out 3 times to see the US is over there. We are getting the life expectancy today that is 60th, 60 in the world out of 210 countries or so. We spend 3 times more money than any other country in the world. Like, what the hell? Like, that's unbelievable. Like, we are not getting any benefit And at the same time, if you have a good health insurance and you're living in the right city, you get the best cancer care, you get the best care on the difficult things that we have. But then we spend less than 2% of that money into preventative care. And most of that money is going into screening, vaccination, testing. Hardly any of it is going in education and kind of helping people before they're getting sick. So what to do? I mean, that's a big question. We have to do something because the cost is ballooning every year and it's growing at the high percentage. And the beginning of where we start is so high already that you don't need to add multiple percent on 4.5 trillion and you have a lot of money. Like
Right.
you have hundreds of billions automatically, which is a
Right.
lot more money than my native Finland's healthcare budget a year, for example, which is unbelievable. So what do we need to do on that? And this is not only applying the US. US is just a canary in a gold mine because we are in a trouble. So what happened in the last 5 years is very, very, very alarming. And many people don't know about it. But we have lost 2.5 years of life expectancy in the US in the last few years. Yes, I mean, many other countries have had a tiny tip because of COVID. But in the US, it's much, much more pronounced, very different than any other country in the world. Today, the US men, and you can kind of go look at certain populations in the US, they live as long as people in sub-Saharan Africa. Men on average are living almost 10 years less in the US today, life expectancy, than the men in Japan. 10 years is a long time. That is more than 10%. That's 15% of your life, almost.
Right.
Which is a pretty big deal. Like, I mean, how much it would pay to get 10 more years? Ask that from people. Many people say, everything I have. So those are the issues that are real macro problems. And education is very important. I think that people need to do the right things, but we also need to use taxation and regulatory systems. Like it's silly that in the US we can't do anything to tax sugar, for example. Now we know sugar is a big, big, big culprit of all this. And we are still selling these, gallon sacks of Coke and whatever soda. And everything that we drink is like sugar enforced. We put sugar in anything from bread into,
Right.
meals and dinners. Everything has sugar. Like how many
Right.
recipes you have where you put sugar in the evening meal? None. And every food has sugar at the big
Right.
dose. So those are some of the issues that are very difficult to do because we have no political will. But there is hope. I think, this idea that we have now new technologies coming that I think maybe can solve this partially, maybe in a surprising way. So American, and I think, everybody in the world, we always pick a magic pill instead of the behavior change. We like magic pills, like, the Matrix, I think the blue or the red pill. We tend to take the easy way out. And now we have a magic pill that will help a lot. And that is the new drugs for weight loss, the GLP-1, Ozempic, Wegovy, and others. They are absolutely unbelievable how they work. They actually make you eat half the amount of food you ate before, and you will lose weight. Everybody will lose weight. There are some side effects, and I hope they can be kind of cleaned up on the future versions. But when you pair something like those drugs, and you pair it with this ever-increasing amount of data we are getting from our bodies real time, it won't take long before the Apple Watch Ultra, maybe 3 or 4, it has actually the blood pressure and it has the glucose monitor in it. It means that everything will change because suddenly it will tell you if something you ate is going to harm you in real time. And
That's
that
the
real-time feedback loop changes everything. And you can then gamify. I built games my half my life, and that is a game that we all gonna play, and we all gonna have those devices in the coming years. Half people already have in the US a tracking device, and then the third point that is really gonna be impactful is the AI. So I mean, everybody has now played with the different AI tools, and I mean, for me, I mean, I work on AI stuff now for a decade. It's just unbelievable. Like, I mean, it doesn't make any sense. Like, having been working on like computer vision for 20 years now, suddenly you take a photo of a meal and you upload that into ChatGPT. You ask the AI what's in the meal, it knows. That is a very, very, very difficult problem. People have been trying to solve that for 50 years and not getting even close. And suddenly it was solved. It works now. Like all those things that, in the scientists and, technologists have been working for decades are all now working. And it's like you don't know what to do because it's so unbelievable. Like
Right. Right.
we all thought, and, everybody who read ever any science fiction, we all thought that, the AI will come to us in a form of a robot that will do the home chores and cook and, clean and maybe, take your dog out. That's what we all think.
Right.
And suddenly the robot, the AI, it came to us as a composer, a poet, an author, a business executive. I mean, it is like completely opposite what anyone thought. I don't know. I don't think there's anyone who expected this to happen. So it's so
Right.
interesting to see where the world goes because now it's not replacing it. It can't really still pick rice from the floor, but it can compose a new sonnet or opera. I mean, that's unbelievable. So
Right.
AI will be the coach that people will have because it's difficult to change behavior if you don't have somebody to keep you accountable. It will be the AI. We all know if you have a personal trainer or a personal coach or tutor, it helps. And now the AI will do that for everybody at a very, very low cost, if not cost at all, for free. So now we have million doctors in the US. We're going to have 300 million dietitians and doctors and health coaches to everybody. So those
Yeah.
things, the new drugs, the new tracking, the data loops, and then AI, they will change everything. And I think even if we don't legislate and or change the rules, we're gonna still be able to get people healthier to live maybe 10 to 15 years longer in the next decade.
Yeah, I can connect it with the vision that, AI can help everybody. We can say like having a personal doctor, everybody having. So when we were trying to solve the problem of access and cost in healthcare, basically it gets solved because now everybody could keep a doctor inside the pocket itself or on the phone or
Yep.
probably having access to telehealth that, like everybody would have a personalized doctor, a personalized care plan and like you said, a very custom plan that is built custom for them.
100%. And we just opened up in the US um,
Mhm.
the telemedicine that you mentioned. So
Right.
in the heat of COVID, government passed a law that defined that you can actually talk to a doctor outside of your state borders. That was not legal before.
Right.
And
Yeah.
I was
The
involved a little
licenses
bit on
were required. Yeah.
yeah, so
I think.
I was able to kind of when years ago I was writing those laws with other people that finally were then made into law years and years later. But because it makes sense to be able to open up the playing field a bit. And now and I think the AI, it will take a while before the AI is a doctor because there's so much resistance. And I think, I think many of it, the resistance makes sense, but it will be much faster, your health coach and a dietitian and nutritionist. That will be happening like this year already. And we are building one of those at Elo, for example. So I'm really excited about the future. I'm really scared about the human situation today on health overall because 80% of the Americans are overweight. We are
Mhm.
dying younger than we were before, like I said. So, but there's a lot of optimism in the medium term, but the short term is still pretty bleak. And I mean, why people die, by the way, the US, there are three reasons. One, we are unhealthy. We are unhealthier than any other nation. No thumbs up for that. Thumbs down. We are unhealthy, but even with the good healthcare, we can't keep people alive if they are obese or they have chronic conditions, comorbidities. You can't do that. Second, we have the opioid epidemic in the US that is it's really really bad, and it's not talked about a lot. But the fentanyl and those they are just killing people left and right. I mean, in San Francisco where I live, I don't know, 10 people probably are dying every night in the streets because of fentanyl overdose. And then COVID, of course, had an impact because if the population is unhealthier, then if you get this sort of disease, more people will die by default.
Mhm. Right, right. No, true. I agree. I mean, of course, and the problem, like you said, it's so foundational that it's hard to, basically change it overnight. And I think to be able to solve it, it would only be possible when we have the right intervention with the right timing and the intent coming together. So it all creates that best environment for something like technology that can, intervene in a natural way, not like, probably we already had all these supplements, through ages, but then that's a separate thing that you have to do going out of your course, as compared to if something can be as organic as your daily habits, and then very custom to you, then it could really help you.
And you refer, I mean, like, how do we kind of fit Elo or our play of building better nutrition, smart nutrition here? So we are trying to, we know that we all have our own diet pattern. We all have the foods we like. We are all pretty unique in that. And personalized nutrition, it doesn't really need to be personalized exactly to you, but there has to be ability to get the food we like to eat, get the nutrition in different ways. That is a good experience that it's better than what we have maybe today. And
Mhm.
and the coaching and everything, you know, helping the people get the right nutrition at the right time and then nudge them to do the right thing when they are making decisions. So the problem is that, there are a lot of apps and services where can, you know, you can lock your food and you're going to know after the fact roughly what you have done. That's too
Mhm.
late. We have to
Mhm.
almost tell you before. So that is the big, I think, unknown that nobody
Mhm.
really has done yet. How do we use this new world where we have more data coming in, where we have ability to customize and ability to deliver quickly? How do we do it in a way that when you're making a decision what you're going to eat or planning your week or whatever, you get the right things? How do we get to the beginning of the problem? So that is the big deal, I think. And there's some unbelievable examples today. And I'm really excited about one company that I know the team pretty well. It's called January AI, month of January.ai. And they built a system that is maybe the best implementation of the food logging ever. So you can open the app. It's a free app today in the US in iPhone. You can take a photo of any meal. It will use the ChatGPT for I talked about, which is really, really good to recognize what's in there. Then it will look at the micros and macros and stuff like that. And then they
Okay.
use their own model to predict what is your glucose response to that food.
Okay. Mhm.
And that is really, really cool to think about. Like you don't need the glucose monitor. You don't need to add anything. You just snap a photo and you see the impact on your health then and there. That
Wow.
is pretty cool. And think about when you add that into somebody like Whole Foods or Instacart or let's say Walmart. When you shop, you could see already when you are buying that you are buying stuff that will not be good for you.
Mhm. Right. Right. No, that's true. That's why I keep saying that, thinking about the future where, doing monitoring to taking control to, like taking action about it is so natural that, like eventually because we are all lazy. So, the more a solution is nearer to our normal behavior and not like a external agent, the more chances that, we would possibly accept it into the routine and be able to take action towards it.
And even that might be difficult for people to comprehend. And that's why I often tell people like, let's give an example. And I think the example, living in California and it's a local company here. But I mean, Tesla is such an interesting company, not because Elon Musk is the most interesting or vocal person in the world, but more like what they have done, because they started to create electric cars that are not the best electric cars. They are better cars than the normal cars we used to have. They didn't win as a company because they made the best electric car. They made the best car per se. And anyone who has a Tesla, we can we can we don't have to debate about Elon or about the build quality, but overall as a car, it is really good. I mean, it does some things that your normal cars won't do. And it
Right.
also has like what, three buttons or something. And you look at any normal German car or whatever, there's like 55 or 100 buttons in a car. They took all that away. They made some decisions on design that were really brave. Like really brave. Nobody had done it before in the car business, and now everybody are copying what they have done and simplifying desperately their cars. And they just made some of these things like, like
Mhm.
now they took the swipers even away on the newest versions. There's no like this, you don't have a like a the
Yeah,
signal or the light. They're all done differently. And they
right,
took away the speedometer. I mean, that's unbelievable. Like they put it onto the dashboard. I mean, like nobody had ever done that before.
right.
And by doing
You got
that,
to disrupt, yeah.
yeah, and they did that in a way that, they captured people's minds
Mm,
and they truly built a better product. And that's
right.
like what Apple did. We were building at Nokia, we were building the smartphones, and we built decent phones. I mean, like a billion people used them. Now nobody
Right.
used them. Apple
Right.
built such a good product that it was just a better product. So in the end, when we think about the nutrition, the health sucks at building good products. Can you name one good health product that people are like raving about? Nobody has that. It hasn't been done yet, but that will be the way in the future. We need to build products that are so good that
Right.
people talk about them to their friends and they rave about them. Think about when you bought your first iPhone, if you have had an iPhone. How many people you talked about it? How awesome would it was it in the beginning when you have like you use a fingerprint or use a face to log in? I mean, that they invented that. That was pretty cool stuff, by the way. They spent many years to build the facial recognition system. They built a new CPU for a new processor, and it works like magic. And how many people can walk home and open the lock with your face? Nobody.
Mhm.
Like, why can't we do that? That's way better way to do it. Why don't they have a key?
Right, right. Right. No, true, true. Such a nice quote, actually. As I was, yeah, I mean, you pretty much nailed it here. That when we say it has to be natural, it has to be organic, it has to really sync well. I think it all has to come down to that. It has to basically do things a better way, or better than what already exists. So, disrupting the market with simplicity, of course, but then that's the ultimate sophistication.
And that's why, like, one thing that we have been doing at Elo a lot that I think, I would love to see a better. We can't change the world because, we are a small startup, but the testing. So, now you can take the Elo test and you can get, 15 or so biomarkers. Uh, you do the pricking at home, but
Mhm.
still it sucks. You have to make a hole in your finger to bleed. That sucks. But
Right,
think about this: millions of people every day are going to a lab. They roll up their sleeve. This big needle gets into the vein, and
right,
the doctor takes what, 5 or 6 vials of blood. They only need like one third of that, but they take six. Like, what the hell? And that's how we do it. And then you have to walk, you have to drive into another place or part of the city or city even to give blood. Like,
right.
that is a fundamental need we have. We need to collect people's biomarkers more often at the better
Mhm.
way. And
Mhm.
still we do it that way. We done it the same way 100 years. So I'm like,
Mhm.
healthcare is so ass backward at times. And look, why is that? We have a lot of reasons, but it's like a monopoly and all these regulations and blah blah blah. But
Right.
it's just crazy. We have to become better, and it's not that difficult. I think when people invest big amounts of money. If I'm in San Francisco, one thing
Right.
I always do when I have friends coming over from outside, first thing we do almost, we're gonna hop on a car that is a self-driving car, Waymo or one of the other cars. And everybody is blown away. They're like, what the hell? Like, this car is driving better than I am driving. Meaning
Right.
me mainly. I'm the crazy driver. But the point is, it's way better. And it's so much more convenient. And it was free for the first year. So I was in a alpha group of people testing those. And, we hop on a car and it's free and we get to anywhere in the city.
Mhm.
And people couldn't believe that. So if you can make a car drive itself,
Mhm.
why can't we do these healthcare things? It shouldn't be that difficult.
Right, right, right. No, I think it's all about, someday, somewhere, and probably it could be in this room, like an entrepreneur only has to do it because, that's the whole beauty about entrepreneurship or startups that, they are the ones that can only change the world.
But healthcare, it's so difficult though that, like as an example, I talked about the Apple Watch and the glucose and others coming there. I have spoken to many people, and even companies, big companies, valued many tens of billions. they say it's too difficult for them to do that. They don't have the money to do it. They don't have the
Yeah,
resources.
Amazon has put in so much money. Google has put in so much money.
Yeah,
Yeah, and
only companies who only people who can do it are Amazon, Google, and Apple. I don't think even Samsung can do that. So you have only three companies, maybe the Chinese companies probably who can also do it. But in the US, there's only three companies who can get pulled it together. And that's really tricky because as a startup, I mean, I can try to start developing a better, sensor, laser, or lens, or whatever analytic. But I mean, hard to build that company to be a real company without raising $1 billion or so or more.
right, right, right. Do that. Well, thank you so much, Ari. That has been a really insightful discussion. Thank you so much. I really enjoyed my time on this podcast and with your beautiful insights and the deep knowledge that that comes with passion, definitely, about what you're building and that really, puts us at least 1 inch forward to change the world.
Cool. Thank you.
Thank you. Thank you for joining us on the Health Tech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.